Hi, Amy. Welcome to our session today. How are you feeling this morning?
I'm all right. Thank you. How are you doing?
Doing well. I'm glad you made it today. Let me get started with just a few kind of background things before we get started.
Okay.
Um, Today, I'm going to be asking you a lot of questions just to get some background information and get to know you a little bit better. That's going to help me figure out what's going on so that we have a better plan moving forward. If you don't understand any of the questions or if you're not sure what the answer is, that's okay. I'd rather you stop and ask me so that we have better groundwork to build from.
Okay.
Everything that you say to me is confidential unless you talk to me about wanting to hurt yourself or someone. Okay, do you have any questions before we get started?
I don't think so.
Okay, great. So, Amy, can you tell me when you were born?
I was born February 17th, 1994.
Great. And what brought you to me today?
I just I feel sad a lot. It seems like it's most of the day anymore, almost every day. And I'm married, but we've been separated, and I think it's just been a lot. I've just been feeling down.
Okay. And so some words mean different things to different people. So when you say that you feel sad, can you explain that to me in a different way?
Yeah, I can try. I feel kind of, mm, I don't really feel like right now I feel like there's anything that I look forward to, kind of maybe maybe not hopeless, but also maybe hopeless. I've been feeling just sort of tired and like I have a hard time getting myself to do things or go places or be social, just down in the dumps kind of feelings.
That's a great explanation. Thank you for explaining that more to me. Um, did anybody refer you here or did you decide to come on your own?
I decided to come on my own. I don't want to feel like this anymore. I miss just living my life and stuff and feeling happy and yeah.
That's really great. It takes a lot of courage to take that first step to seek help for yourself. I'm really proud of you for doing it.
Thank you.
All right. So, have, how long? You said you've been feeling sad a lot, but how long has that been happening?
Really, I feel like it all started about 4 years ago, and I think it's just kind of gradually got worse.
And had that happened before 4 years ago and gone away, or has that been just starting 4 years ago?
I think it really just started 4 years ago. I remember feeling like a little moody in my teens, but I think that was pretty normal. But yeah, about 4 years ago, this all sort of started, and I don't think I've really had a period of time in my life where I felt like this before. So
And has anybody else in your family ever gone through a period like this where it's lasted more than a couple of weeks or months?
my mom and my grandma, they
Okay.
both kind of have, and when it comes to my grandma, all I really know is some stories from my mom. But I do remember as a kid just periods of time where it was like my mom was spending a lot of time on the couch and with the lights off and just down, and I I don't love feeling like that's how I've been acting or how I've been feeling, but it definitely feels similar to what I've seen from her.
Okay. So if I asked you to rate the level of sadness on a scale of 1 to 5, with 1 being the least sad you've ever felt and 5 being the absolute worst, on a normal day for you, what would you rate that sadness?
I think maybe a 3 or a 4.
And is that the worst that it's ever been?
Yes.
Okay, so it never gets above that three.
Sometimes I feel like it's a 4. Yeah.
Okay, that's understandable. And how has the sadness impacted the things that you would normally do? Like, has it impacted your job or activities that you would normally do?
Yeah, I feel like I've been calling off more from work. Um, and just sort of falling behind on work assignments and also just keeping up with the house. I feel like I everything's been a mess and it's all felt really overwhelming.
That sounds like it could be really overwhelming for you, right?
Yeah.
So definitely by the end of this, we're going to come up with some ways to help you cope with that so that maybe we can start making some progress. Um, have you ever had a period of time where you wanted to harm yourself in any way or thought about dying?
No.
Okay. And any thoughts of wanting to hurt anyone else or wanting to kill someone?
No.
And have you ever experienced times where you have seen or heard things that other people haven't seen or heard?
No.
Have you ever been to a psychiatrist or a therapist before?
I have not. This is a first for me.
Okay. Do you remember if your mom or your grandmother ever sought treatment for their depression?
I remember my mom did. I don't think that my grandmother did.
And were they getting just talk therapy or were they on any medication or any other kind of treatment?
I remember my mom having to go on medication. I don't exactly know what it was that she was taking,
Okay.
but yeah, I do remember her having to go on medication and taking it every day.
And have you ever been exposed to any kind of trauma? Anything like abuse or abandonment, anything like physical, emotional, sexual trauma?
No.
And are you currently on any kind of medication at this
I take a birth control pill, but besides that, no.
time? And any history of substance use or alcohol use?
Just alcohol use in like the normal. I think like it would be like a normal amount. Very rare. If I do have a drink, it would be with like maybe a friend once every few months. Nothing that's ever been a problem.
Okay, and when you say very rare, can you describe that to me? Like, how often would you say in a week?
In a week, I think less than one in a week. It's more about like once a month.
Okay, and how much do you drink at a
It would be like if we went to dinner and I had a glass of wine.
Great, thank you. All right, and you mentioned that you were married, is that correct?
Yes, I was married for we were married for about 8 years, I
But
think. Yeah.
you were separated?
Yes.
How
We've
long
been
have you,
Oh, sorry.
I'm sorry, I didn't mean to interrupt you.
Oh no, it's fine. We've been separated for the last year.
Can you tell me a little bit about what happened there?
Um, there was some suspicion that he might have been having an affair, but I think at the root of it, it just sort of came down to a lot of miscommunication over the years, and things being kind of put off to the side and not really addressed, and then it all kind of blew up over, it felt kind of random, but I think it was kind of coming on for a while.
Do you have any children right
No.
now? And can you tell me about your education?
I went to, sorry,
How far did you go in school?
I went to college and I got my bachelor's degree.
What was your degree in?
It was in communications.
And what do you do for work?
I am currently not working. Just recently was let go due to poor attendance. So
And what were you doing before that?
before that, I was doing an HR job at a factory.
How long have you been in that position?
It had been there for about, I think it was about 2.5 years.
Have you ever served in the military?
No.
And talk to me about who you have in your support system. Do you have any family or friends who are supportive of you seeking treatment?
So I still have my mom, and she's really the one who's encouraged me to come in today and talk, just because, she has noticed in me some of the signs that she had herself, and thought it would be good for me to seek out some treatment or just to talk to somebody, really. And I have a few good friends that I've known from college that I still keep in touch with, and I think that's probably about all the people I would feel comfortable going to for support, but I do have some people.
Well, it's good to have people in your corner. Any history of legal problems, any criminal charges or anything like that?
No, nothing over a parking ticket or anything like that.
Any medical issues, anything like high blood pressure or diabetes, anything like that?
No,
Do you have a current medical provider that you see for any?
I have like a family doctor.
It's good to take care of just the regular medical problems so that they don't interfere with anything psychiatric as well. Any history of head injury?
No,
And are you allergic to anything?
no.
All right. So, based on our conversation today, I have a preliminary diagnosis. I don't want to set this in stone at this moment. I think we need some more time together. But based on what we've talked about, I believe that you're suffering with a major depressive episode. And I think that it would be good for us to utilize cognitive behavioral therapy, which is a type of therapy that works on the thought processes and trying to readjust those to focus on things in a more realistic way. So we get caught in these automatic negative thought processes and aren't able to focus on the positive things that are going on around us. And so what I would like to do is set up a few more sessions, meeting once a week for a little while, so that we can identify those automatic negative thoughts and work on processing those in a more positive way. Is that something that you would be willing to do?
Yeah, for sure.
Okay, great. So let's get those next sessions set up, and then we will keep working from there. I
Oh,
appreciate you coming in today. Thank you so much.
thank you.